Okay, so I wanted to share with you 3 exercises that are really, really good for helping to say goodbye to that low, like annoying low back pain, sciatic discomfort, and things like that. And so these exercises are great for that, but the other side of it is also really important to learn how to properly strengthen your deep core. So I'm going to show you these. These are something you can do, on a daily basis. So grabbing a foam roller, and I like one that's a little bit softer, okay, can be good. Sometimes the harder ones are just a little bit too aggressive, especially during pregnancy, because your body can just be a little bit more sensitive. So when you're doing this, you want to kind of start up at your tailbone. And whenever I teach anything, I always want you thinking about opening up across your chest. We're not just here hanging out. I want you to really lengthen up, so we're using our mid-back. And so from here, you're going to do a little just rounding of your spine and lengthening and lifting. So we're opening up across our chest because during pregnancy, we can tend to get really tight across our chest as our boobs get bigger, postural shifts that start to take place, which is sometimes where the back pain comes from. But you don't have to let your posture become excessive, okay? So with this, we're going to kind of think about rounding and massaging into that roller. This is why soft can be better. Just a little bit, like a little pelvic tilt here, back and forth. And then what I want you to do, you're going to be pushing lightly into that roller, and I want you to start to wiggle back and forth, okay? So when we're doing this, we're not just rocking side to side, you're actually going to lightly pushing into that roller, and you're going to start to work up towards your low back. So you're right on top of your sacrum. And what this is going to do is, if there's some restriction and tightness of the fascia that's on maybe one side of your sacrum, because your pelvis is starting to expand and things are starting to shift, this can help to loosen that up, okay? And then kind of going down to that tailbone and wiggling. Yes, we call this the wiggle stretch, because that's what you're doing. Good, and then you can go up to right into your low back. Good, and then come all the way up from there. Now, when you're doing this, it should never feel painful. It actually should feel really, really good. Okay, so that's one thing, just kind of waking that up, because as your pelvis is shifting, ladies, and opening, because baby doesn't sit to square in our body, it could be kind of sitting towards one side, and the way we're sitting, standing, or walking or moving throughout our day, we could be a little off balance. So sometimes we have to just really bring some focus back into are we gripping or too tight on the left side of our sacrum, and that's what's causing our sacrum to really pull and twist, and that's what's causing our back pain or our SI pain, sciatica, things like that. But I want you all to know that you can do something about it. It is a total myth that you have to have back pain during pregnancy. Sometimes you can't 100% get rid of it, but with everything that I teach, I've always been able to help women dramatically decrease it, and for a lot of them, they're able to completely get rid of back pain. Absolutely. Okay, so it's a combination of the things I'm going to show you today, as well as other things with strengthening as well, and being aware of posture. Okay, so the next one, number 2, is you're going to shift a little bit more over to kind of just that angle of the glute. Okay, so we want to go to where that sits bone is, and you're going to round your spine, pushing in lightly up into all the way up into the upper glute. We can get really tight through there in the upper glute, and that can really pull on our low back. And then massaging down the hip, and then rounding and pushing into that, and coming all the way up. And if you find a spot, maybe you do feel oh yeah, Erica, that upper part of my glute is really restricted, it feels really tight, just go really, really, really slow over it. Just encourage that tissue to open and release. And this is why I like an exercise that's really good to help keep the upper glutes from overworking is doing squats. But doing squats so you're working the hamstrings and the underside of your butt. Okay, so I'm going to shift over to the other side here, doing the right. Okay, so you can kind of see my angle over here. So I'm just off to the side. You can go all the way down to the outer of the hip and the sit bone, and then nice and slow working all the way up into that upper glute, and then back down, lifting up tall. Good, and again, you might find that, oh my gosh, this side is super crazy tight, and the other side you don't really feel anything, right? It's really important to pay attention to the balance of what's going on with our pelvis. And this is where what's going on around our sacrum and our glutes and our posture is so powerful and plays such a big role. Okay, so I'm going to move my roller out to the side. This next one I'm going to show you, ladies. So if you're absolutely not comfortable on your back, just watch me do this. But if you are comfortable on your back, and one thing I'm going to say about this, the exercise I'm going to teach you, it's going up into more of a hip roll, is it can be really, really, really good and effective during pregnancy. Because once you get your hips up, you're no longer flat on your back. So it's really just going onto your back to get yourself up a little bit higher, okay? So when we do this, we always want to make sure, even if you're just in your 6 weeks pregnant, I want you to start practicing going from your side over to your back. So we're not putting a lot of extra stress on our abdominals. And then from here, I want your legs a little bit wider. We're going to rotate the knees in, and you can just lightly push your knees together. So when we do this, we're going to actually be getting and creating more space at our sacrum and through our hips. Okay, so when we do these, we're going to start with that little pelvic tilt. So we're thinking pelvic floor lightly drawing up, giving your baby a nice little hug. And then once you go to lift, you're going to squeeze your glutes and hamstrings lightly, and you're going to go part way up to where you can feel like, okay, you're getting some pressure off that pelvic floor, things are pulling into your body, and you're starting to feel your glutes and hamstrings working, and then you can soften your ribs and articulate and roll back down. So keeping mobility through your spine where you can articulate is really, really, really important and can really help prevent and get rid of the back pain. Okay, but this one's also good because we're getting a little traction at that sacrum, and we're also working, you can do a couple little pulses here, we're also working to get the glutes and hamstrings to work without going into the low back, okay? So you can do some articulation here, and again, when you do this, you're only gonna be doing this for maybe a minute or two, and then when you're done, I want you to roll to your side to come all the way up. Okay, here's a couple questions, so I'm gonna address those. So those are things you can do every day. If for some reason, if those do not feel good for you at all to be on your back, you can do what I call a standing cat-cow with a chair. Those can be really good to just work on that articulation. You're connecting with your deep core. You're allowing to get a little pressure off of your pelvic floor, which also can play a role in what's going on with back pain. Okay, so I was just going to see if I had any questions. Oh, no, you ladies are just tagging women. Awesome. Thank you all so much for tuning in. If you have any questions, please don't hesitate to ask. If you're looking for more, you can find so much information on noctafitness.com. And also check out one of my free pregnancy workouts. I posted the link above. It's ericazeal.com/pregnancy workout. Super, super easy to find. And I hope you all are doing well and staying active, eating healthy, keeping moving, and just taking a moment throughout your day just to pause and center and connect with your body and connect with your baby. And one last little tip is I want to remind you all to visualize what you do want for your pregnancy, what you do want for your birth, what you do want for your baby and your family. Like, there's so much power in trying to let's spend our time visualizing what we do want instead of spending time and worrying about what could happen, because that's not happening, right? What could happen is not what is happening, right? That's just fear speaking, and you have the power to control that. That is one of those things that you have the power to control. So you've all got this. Keep moving and have a wonderful week.